have been in short
Conference will
supply.
now be recorded.
Sorry about that. I don't know what's going on. And it's been on a 2-week backlog. And what I've heard is the two major manufacturers globally for the testing swabs and the transport media, one is in Connecticut and one is in, of all places, northern Italy. So there's a global supply chain issue with the testing. My understanding is it's sort of hit and miss right now. Some people are able to get tested quickly, depending on what provider they have. Does that provider have the transport media and the swab? Can they get that to the LabCorp Sonora Quest quickly? So sometimes it's happening quickly. Sometimes it's been slow and there's been struggles getting data back or even getting tests at all. As you know, there was a letter from the Department of Health Services urging primary care providers to recognize that because the testing is in short supply, they may not be able to use that as part of their the information from that test as part of their clinical management of the patient. That's just a sheer reality. I think when we do a hot wash of this response nationally at the end, I think we'll recognize that testing was really a missed opportunity for us as a country to get ahead of the game and better identify cases and allow for people the information they need, for isolation and quarantine, which would have been super helpful. But it's just a reality of where we are with the testing challenges. Similar thing on the third bullet there, which is personal protective equipment. Again, global supply chain issue. It's nobody's fault. There's a system fault that the PPE in general, the supply chain for PPE for the most part starts in China, which, as we know, is where the place is where this pandemic started. And so they are just now starting to come out of lockdown and the dramatic social distancing and other civil liberty challenges or restrictions that they've had. And so their factories are beginning to get up and running, but there is a global shortage of PPE, masks, gloves, gowns, etc. That is probably not going to change. From what I've heard, Arizona's received 75% of our strategic national stockpile for PPE, and that's the gloves, gowns, masks, etc. It surely is helping. I think the process is that the SNS is taken from, it's delivered to the warehouse at the Department of Health Services, and then that material is transferred to the county health departments, who then prioritize where they believe it can be of its best use. So the county health departments are making those decisions. By and large, from what I've heard, most counties are prioritizing inpatient because they see that as the most important critical control point for having that PPE. And also at ADHS on their website, they've got the levels of some guidelines around how to conserve PPE effectively. I think most providers will be in what's called contingency mode now, meaning they're making decisions about how to use PPE differently than they would under normal circumstances. And depending on how the epidemic plays out in our state, it could be that they end up under the crisis category. And you can see those links of what that actually means on the ADHS website. One thing I did want to mention that I believe is important, but you don't hear that much about, are pharmaceutical interventions, because so far, the responses from public health to this pandemic have been, by and large, what we call non-pharmaceutical interventions. That's, the social distancing, the business closures, and so forth. But pharmaceutical interventions, I believe, can play a really important part of the response. Just last week, or maybe it was even Sunday, I think it was Sunday, the FDA issued emergency authorization approval for hydroxychloroquine and chloroquine as treatments for COVID-19, not for prevention, not for prophylaxis, but when a person presents to, for example, an emergency department, is having trouble breathing, they may go up to the floor and get supplemental oxygen. That might be a candidate for hydroxychloroquine and Zithromax as a potential treatment. There are trials that are happening all across the country. I've got a blog up about that coming later on this afternoon. But where the pharmaceutical interventions can come in very handy, I think, is in those people, for example, that are in a hospital on supplemental oxygen. If you could get them started on one of these experimental medications, it's possible that we could limit the number of people that go from supplemental oxygen to full-on needing intubation with a ventilator and moving to an ICU environment. So there is, and I blogged about this a few days ago, there is some promising, although you know, it's not peer-reviewed and so forth, and the sample size is small, but there are some promising, I think, pharmaceutical interventions, and I think it's not getting as much attention as perhaps it should, because if one or more of these medications work that we can get in decent supply, it may really help across the whole country at keeping that wave down on the ICU bed side. So, you know, still have the number of cases we're going to have, but if the treatment can help slow people moving from supplemental oxygen to ICU, that would be great. Moving quickly to the stay-at-home order, you probably, of course, you heard that the governor issued a stay-at-home order. There's been a lot of, you know, chatter about what it does actually do. I did a radio spot yesterday with KJazz where I just sort of took a step back and said, look, you could talk all day about what does the order actually say and is there compliance to it, but the purpose behind it is what's important, which is urging Arizonans to stay home when they can, do everything they can to do the social distancing, because it's one of the key critical control points that we have in terms of flattening the curve. So to me, it's less important, you know, the details of our nail salons open or not. What is important is to encourage people to do the very best they can to follow the simple guidelines around staying at home when they can, unless they have something that's really important that they can't delay. On the hospital capacity side, there are a number of things underway. Number one is the executive order from about a week ago, where the governor ordered the hospitals to come up with plans to increase their capacity by 50% in the next 2 weeks. I think the first deliverable that those hospitals have is their plans that I think that are due Friday. So the idea behind that is to free up capacity. One of the interventions in that executive order was to require the hospitals to delay or postpone elective procedures, again, with the idea of freeing up beds. I think most of the hospitals already had plans underway before that executive order. I think by and large, those have been implemented, as what I've been hearing across the hospital system is that because of the drop in the number of elective procedures, there is very low volume across the system right now in terms of you know, what the census is at most of the hospitals. And I've also heard that many of the EDs are reporting that it's very, very slow. I think in part because people who would have normally gone to an emergency department for something might not go now because they're fearful that if they do show up at the ED, they may expose themselves to COVID-19. That could be in the human psychology. I don't really know. But the executive order goes a long way towards building that capacity. And there's also some alternative care site planning that's underway. And you may have heard the St. Luke's Hospital down on Van Buren, which is the State Health Department has plans to open as an alternative care site for COVID-19 patients. There's a lot that has to happen in order to make that work. You know, it's not just the beds, it's the staffing and capacity and who's going to manage it and billing and all that kind of stuff. So that's not a simple thing to execute, but it may actually be something that's necessary in the end. On the communication side, you know, one of the things I'm encouraged in the last few days has been that we're beginning to see more voices with expertise out in the media, and that was lacking, I think, in the first couple of weeks. And the reason I think that's important is because we have a lot of experts at the universities, for example, the U of A College of Public Health, clinicians in the field, emergency department doctors who have important messages that they can share to help provide some color for the public out there in Arizona. And one of the things I'm encouraged to see is that the number of people that are stepping forward with information that they have to share that the public is interested in is beginning to become more robust, which is, I think, a good thing. There's no way that 2 or 3 or 4 people can be the single message points for something like this. What I liken it to is that in order for the public to get the information they need, it needs to be a symphony of expertise from around the country. And so that's one of the reasons why I've been volunteering to provide whatever perspective I can, given my background and experience. The last bullet, I think, is an important one, and it's something that we should all be thinking about now, but it will be, I believe, the longest lasting public health part of this whole episode is that the interventions, which I agree with are necessary, the social distancing, some of the things around business closures, et cetera, are having a profound impact on our economy. Many people are losing their jobs. There's record numbers of unemployment claims coming in. It is having these interventions are having a devastating effect on our economy, and as is often the case in the United States, the people at the low end of the income scale are the ones who will suffer the biggest burden as a result of these interventions. The unemployment that's coming out of it, the downstream effects that these kinds of interventions have with respect to the economic decline on the social determinants of health. And so, at some point this fall, we'll probably see, that we have the COVID-19 pandemic, the worst of it at least behind us. But what will be in front of us still are the public health impacts that come from the economic decline that may go on for many, many quarters. So with that, I think I stayed within my time frames. So Alan, let's go back to you.
Okay, thank you. I'm double checking to see, yes, I am still a presenter. Thank you, Will, very much. We just wanted to kind of set the scene because when we scheduled this, we didn't know what we would be talking about today. So thank you. I'm going to turn it over to Joe from DES. He has a last name that's hard to pronounce. I opened up all of
Alan, can you hear me?
I opened up all the microphones because Joe is not identified. So I'm going to start. Joe, if you would just start talking, I've got like person 1, 2, 3, 4, and I'm going to start opening it. So start singing a song or something, Joe, so I can say something to see if you are this number. No. Okay. Joe, are you there? Joe, are you there? Joe.
I'm here.
Joe. All right.
I'm
I
here.
found you, Joe. Excellent. So go ahead. Joe is Deputy Director at DES. We've asked DES to speak today because so many public benefits that are so important to people right now are the responsibility of DES. And Joe, you can see his area of responsibility. So Joe, it's all yours.
Thank you, Alan. This is John Gruenhagen. It's Gruenhagen. it's long, but it's
so
not hard.
I was calling you Joe instead of John. I was focused on that last name. Mr. Gruenhagen.
That is okay. Thank you, everyone. And thanks, Alan, for the invitation to speak today. We are doing an awful lot of work here at DES, providing services to nearly 3 million people in the state of Arizona, including the most vulnerable of our citizens. And we take our responsibility very seriously. Every single one of our teams here at DES are stepping up, working tirelessly to manage through significantly increased needs of our population. That is one thing that has had a huge impact on me these past 3 weeks. virtually every single area of our department is affected by the pandemic and the customers and clients that we serve. And so you should be proud as a resident of the state of Arizona to have individuals working for you on your behalf. It's been truly inspiring. Obviously, the impact of the pandemic has an awful lot of impacts on our programs, and it requires us to leverage our collective experience and expertise to make sure Arizonans get the help they need through this difficult time. We also recognize that events and information are very fluid and can change rapidly, and we all must realize this will undoubtedly continue over the next few months. As Alan mentioned, I oversee 3 of the 5 program divisions within DES. The first is what we call DBME, and that's the Division of Benefits and Medical Eligibility. In this department, we have responsibility for eligibility and program administration for SNAP, which is our food and nutrition services, and TANF, T-A-N-F, which would be our cash assistance program. We've got approximately 800,000 recipients in our SNAP program and approximately 13,000 recipients in our TANF program. We also administer most of the eligibility for Medicaid on behalf of Access, though Access also handles eligibility for certain of their programs as well. That's DBME, the first division. The second division is DERS, the Division of Employment and Rehabilitative Services. Within this department, we have Unemployment Tax and Benefit Administration, which, as you can well imagine, is busy these days. It also manages our subsidized child care programs, as well as the employment and training programs throughout the state of Arizona. That's the second division. The third is the Division of Child Support Services. And in this division, we administer about 155,000 cases of child support and process nearly $700 million of child support payments each year. So you can see that all of these programs that are covered under these divisions are well affected by the pandemic, and the customers that we serve obviously are impacted to a great extent, and we are doing everything that we can to provide as much support to these individuals as we can. There are one major set of federal laws that came out last week when President Trump signed the CARES Act. There are a number of provisions, a number of funding sources and providers, and a number of services that are covered by the package. We continue to digest the package and the impacts to our programs. We'll speak a little bit about that today, though I would suggest that if we have questions from the group, I'll give you resources that you can access and get up to the minute information on it. Yesterday, the governor also requested from the president a designation of the state of Arizona as a major disaster area. You may have seen that in the news. That also provides, once approved, additional federal assets and resources that we can use once approved. The most important thing that I can give you today would be a website. DES has developed a website that contains all of the COVID-related information, resources available, and that website is des.az.gov/services/coronavirus. If there's one takeaway, it would be that would have all of the information that we have available for our constituents and partners. With regard to nutrition, cash, and medical assistance, SNAP, TANF, and Access, we've got approximately 1,700 program service evaluators throughout the state of Arizona. These are individuals that work closely with the clients in the administration and eligibility determination for these 3 programs. About 1,200 of these PSCs are located in 50 offices throughout the state. We've got 300 that are also located in 3 call centers and about 200 that are in our processing center. Under the governor's recent executive order, as well as federal guidance, we consider ourselves to be an essential function, and as such, are presently manning these offices throughout the state, though in some cases, the work that we're performing will be done on a telework basis. In the 50 offices that we have within the eligibility division, 14 offices are in the Phoenix metro area and 4 are in the Tucson metropolitan area. We are currently operating 6 of the urban field offices in what we call a virtual or remote services only environment, where we're encouraging clients to use the phone or internet access if at all possible. This leaves our office staff ready to serve those clients without phone or internet access that may need an emergency SNAP card, and to those clients that need to drop off documents. The remaining 44 offices are dispersed throughout the state, and we intend to roll out additional virtual or remote services only offices as we move forward in the coming days and weeks. It is important to note that we are not turning away clients and have not fully closed our offices. If clients request to stay, they are seen in our office. We also have field offices in our other 2 program divisions that are implementing similar procedures as well. But again, other than 2 offices on the Navajo Nation, none of the DES offices at this point are closed. We have call centers, as I mentioned. We have telephone numbers where people can have these services provided to them over the telephone. The number is 1-855-HEA plus 432-7587. We also have a website for our eligibility information and access. That website is health.gov. There are a number of waivers that we have requested from the USDA with regard to our SNAP program. These, again, are waivers that we have requested. Some we have received an approval on, some we have not yet, but hope to very soon. These waivers were requested to make sure that we have resources that are easy to access and available to all who need them, and want to make sure that we don't have a situation where if there is a need that we've got a limitation on service. And so what we wanted to do in seeking these waivers is ease the eligibility and access for our clients. There are effectively 5 major categories of our waiver requests that have to do with SNAP. The first is to approve the applications without an actual eligibility interview, and this will hopefully allow people to not come into the office and be exposed potentially to the virus. The second is to allow all eligible families to purchase prepared and hot meals from grocery stores. Third is to waive the work requirements for eligible students. Fourth is to provide eligible family with the maximum allotment allowed for up to 2 months. And then finally, extend the certification period for 6 months. Those are the waivers that we have requested from the USDA, Food and Nutrition Services Department. And as I mentioned, we're in the midst of receiving approval for these, and then once approved, putting those into effect within our systems. On the TANF side, we have also implemented certain changes to the benefit and eligibility rules for this benefit program. In this particular case, we work with the Department of Health and Human Services at the federal level. And what we've done in this particular case is we have also waived the work requirement, waived the requirement for initial interview, and waives child support participation for these benefit seekers and recipients. That is our nutrition cash and medical assistance program. I want to speak a little bit about unemployment. You've heard in the news that the number of weekly initial applicants has skyrocketed. On average, we've been receiving about 3,500 applications per week. During the Great Recession, the highest weekly initial claim number was about 11,000, and that was during the week of July 4th, 2009. For the week ending March 21st, our count was 29,333. For last week ending March 28th, it was 88,592, and we're on a trend at this point to exceed that number this week. Because of the increased call volumes in our UI call centers, as you can well imagine, we are directing as many applicants to the website for the application, and that website is azui.com. I mentioned the website earlier. That's a major takeaway from today's conversation. This would be another. We've got normally 13 people answering calls in our UI call center, but we've now augmented the staff to nearly 100 and continue to augment that staff as we move forward. We're working very hard on that. We are also working to implement certain state and federal laws that have to do with unemployment. Some of these require an implementation time. Some of these require further guidance from the federal government on how to implement it. We are in the midst of doing whatever we can to implement program change and making process changes for these changes, understanding that we still need to wait for guidance on a few of these in the coming days. First, generally speaking, most of the changes will be retroactive back to January 27th, except for one provision, which is the $600 additional weekly benefit, and that is retroactive to March 29th. Generally speaking, and depending on the application's timetable, applications that have already been submitted are going to be pending guidance from the DOL and our ability to implement the changes. And so we're hoping to avoid a situation where if we have provisions of these laws and changes that aren't yet fully implemented, we don't have a situation where the client has to reapply and lose its original application. That's something that we're working real hard to prevent. Many of these changes have to do with alternative standards regarding eligibility and employer chargeability. There is state law that requires a 1-week waiting period for unemployment benefits. We are seeking to waive that 1-week period. We are temporarily suspending the work search requirement for individuals receiving UI benefits. And then, as you may have heard, there are certain provisions of the CARES Act that apply to unemployment insurance, unemployment coverage and benefits. One is that it provides an additional weekly benefit of $600. The other, that it's offering an additional 13 weeks of extended UI benefits. That's on top of the 26-week period currently available. And then, most significantly, it establishes the Pandemic Unemployment Assistance Program, where unemployment benefits are extended to individuals impacted by COVID-19 that otherwise would not have been eligible for UI benefits, those largely being independent contractors in the, in quotes, gig economy. We are also using federal funds that have been provided to the state to subsidize even further our network of child care providers, and equally important, extending child care free of charge to the essential government workers, the first responders, and those kinds of people that are servicing our state. That's a lot of information. I understand that. And I think the best thing to do is to use the website that I gave earlier. It has everything on there. Everything is kept current as much as we possibly can. And we strive for complete, accurate, and consistent information. And with that, I'll pass it back to Alan.
John, I've got a couple questions for you. Thank you very much. The first question is, could you repeat the website just in case somebody didn't get it down the way they wanted?
Sure. The first one is des.az.gov/services/coronavirus. And the second for unemployment would be azui.com.
Very good. Now, a couple other questions have come in, and so I'm kind of moderating them. One individual has asked, they've shared a lengthy story with us, but somebody needs to get connected to DDD. Do you have a separate phone number or pathway? Because the person already is receiving medical and SNAP and other things, but whoever is helping this person, they're trying to figure out where do they go to get connected to DDD.
Those services are provided in another division, not under my purview, but I think the best thing to do is, one, I can give you my telephone number, Alan, and if they call me, I could direct them to the right person, or if they just go to our website, des.gov, that might help as well.
Okay.
But it depends on the type of service, but I think the best thing maybe would be to them to just call me and I can guide them to the right person.
I will, you can just email me your number when we're done. I'll pass the number back to this person one way or another.
We'll make sure they get the help they need.
Another question that's come up quickly is, with all these changes that you've listed, some of which are already in place, has Healthy Arizona Plus been updated to take those considerations into account, or do they really not have anything to do with the application itself?
Some of them do, and to the extent they've been approved and implemented into our program, they would be in there, yes.
Okay. Let me check one more time to see if I have any additional questions. Let's see. I'm just again checking. Here's one. What about a person that did not meet the income threshold for the quarter for unemployment? How does that play out with your the thing about no 1 week waiting? Are they related, or does that not?
It wouldn't be related. In this particular case, anyone that historically has applied for unemployment benefits, they would have to wait 1 week before their benefit period would start. Now, there is no longer, at least during the pandemic, a requirement for that week to commence. They'll receive benefits right away.
So hopefully that'll answer their question. And in that case, their application would not have been pended So it sounds like they may have to make a new application. Would that most likely be correct?
It just depends. If I understood correctly, the question had to do with whether or not an income eligibility requirement has changed. And to my knowledge, I do not think that those situations have been affected. Now,
Okay,
one thing that may change, to the extent that the state is declared the presidential major disaster area, that does have additional unemployment related items that come into effect. What's unclear at this point is whether or not they would be in addition to those provisions in the CARE Act that was passed last week. And so I would encourage them to, if there are questions like that, to either reapply or call, and those questions on their specific situation can be answered in that way.
And I have one additional question, and that is that, we've heard about gig workers and stuff like that qualifying for UI under the Act. But what about people that have been self-employed, maybe as a contractor, painter? Are they generally covered as being eligible for unemployment insurance now?
Very likely, yes, depending on very specific criteria. But that was the intent of the what we call PUA program, Pandemic Unemployment Assistance. And so, generally speaking, those people that wouldn't have been eligible for unemployment in the past would be, and so I would encourage an application in that case for sure. Now,
Excellent.
this would be the part that came from the CARES Act last week, understanding that some of this has yet to be implemented pending guidance from the DOL. And as a result, we're not operational yet, but we're doing everything that we can to become operational when guidance has been received. DOL has made it very clear that they want us to wait to implement until they give guidance on these particular components.
John, I know that you have another appointment. Here's your final question for the day. Final Jeopardy. When was the last time you slept?
It's been a busy 2 weeks, and I said this before. I can't be any more proud of the team here at the state of Arizona. Seeing it firsthand, and Jody, you probably can echo these sentiments. But my goodness, you should be proud of your state employees. They have really stepped it up. And in my particular case, with my 3 program divisions, the people have really shined, and you should be proud. But most importantly, it's important to remember that our purpose here is to serve the most vulnerable population in the state of Arizona, as well as those affected by the COVID-19 virus. And that is our preeminent focus, and we work tirelessly to do that.
Well, John, I want to thank you personally for joining us, but please let your staff know that these incredible hours they must be putting in and the demands on them, we appreciate it. I know sometimes DES doesn't get all the credit it deserves, but thank you for this information. Thank your staff, and I'll let you get to your next meeting, and we are going to switch over to Access. So thank you, Joe.
Thank you. Have a great afternoon. Bye now.
Joni, I'm trying to open your, allow you to speak, and I'm having some trouble. Just 1 second.
Okay. I think I might be unmuted now. Can you hear me now?
Try that again. One more time, try that, Joni. Okay, there
Marcus,
you should be.
there we go.
Yeah, I'm going to have to do something to mute everybody else, but it wasn't letting me unmute you. But if everybody else stays quiet, we'll get it all started. And Joni, I'm going to switch you to presenter. Let me just find the right place. And if I can't find the right place, I'll just switch the slides for you.
That would be great. Alan, I have a couple colleagues on the line also who are going to be presenting, so we're going to have to unmute them also.
And who do I need to unmute?
Dana Flannery.
Okay.
And Mohammed Arif.
Okay.
And Heidi Capriati.
And Heidi. Okay. Why don't you just start? Tell me when to switch slides, and I'll make sure that the people that need to be are available to speak when they're up, okay?
Okay. I think Dana is going to start off.
Okay. Dana is open right now. Dana is open right now, so she should be able to speak.
Can you hear me?
Yes.
Okay. Good afternoon.
Just continue. I am muting people one by one, and there's a lot of people.
Okie doke. Yeah, there's quite a few people showing us talking right now.
Yeah.
All right, let's go ahead and get started. If you want to flip to the first slide, today you're going to hear from myself. I'm the Assistant Director for our Division of Community Advocacy and Intergovernmental Relations. You'll also hear from Mohammed Arif on my team, and then as well as Joni, as you all know and are familiar with. So we'll first get started. Similar to what DES said, I do want to echo the utter amazement for the team at this stressful time, really just working day and night and making sure that we get the right information out there and doing all the work that has to go on behind the scenes. So first I wanted to start out with our FAQ document. So similar to DES, we too have an FAQ document and we update that every day. So make sure that you just save that link. That's right there for you. And refer back to it daily. The date that we update, the most recent updates, is going to be highlighted, so you'll always be able to see what's brand new information with ease. They're also in English and Spanish. And then I showed you on the very top, if you go to our website that you're all familiar with, there's a big yellow bar across the top. When you click there, you click to the FAQ. Next slide, please.
My system's reacting a little slowly. There you go.
Sure. So when you click that yellow bar that I talked about on the last slide, you're going to get to this page, and it has the COVID-19 information. It has links to the declaration of emergency, the executive order, and the subsequent executive orders. It also has a link for the request that we're going to go over today that we've submitted to CMS to look at waiving certain requirements or to ensure ongoing access to care. So you'll see both our request to CMS and CMS response back to us there. Then that blue button is where you link to those COVID FAQs. And for convenience, we've also linked the ADHS website and the CDC website. If you look at the very bottom of the screen, you're going to see 24-hour nurse line numbers by health plan. We've also listed every single health plan's nurse line. That way, if you are working with members and they do want to discuss symptoms or concerns with their health plan, they know exactly how to get directly to the nurse line. Next slide, please.
Here we go.
Here's just some examples from the FAQ. Will members lose coverage during the emergency? No. For the Family First Coronavirus Response Act, Access will not disenroll members during the emergency, and then list out the exceptions. So death, those who move out of state, and those who voluntarily withdraw. Members who lost access eligibility in March of 2020 will be notified of their reinstatement. Another question is, does access cover testing for COVID-19? Yes, and it lists the codes and the effective date, and that we already have it good to go in our system. So those are just a couple of examples. There's approximately 50 questions on there, and they're also categorized based on different topics. So if you wanted to learn about telephonic services that are now being offered to our members, I know Will Humble spoke to it, DES spoke to it. We really are looking to move with this and see how can we accommodate still reaching people, getting services, and really look at telehealth and telephonic options so that we keep people connected to care with really following the social distancing at the same time. Next slide, please. Here's another example from the FAQ. During the COVID-19 emergency, will access members be required to pay premiums? No. So one thing to note on the FAQs and everything that's being done to pursue different flexibilities during this time of the emergency, what we are pursuing and then implementing is going to be for the duration of the emergency. So these changes, just to note, are for the duration of the emergency. Okay, next slide, please. Okay, before Mohammed goes into all of the things that we've requested and the status of those, this slide, it can be a timeline, it can be a circle. There's a variety of ways you can think about this process, but just lets you know what work goes on in order to pursue these flexibilities and what that pathway looks like. So Access will submit to CMS changes. There's an 1135 mechanism, which is a disaster waiver. There's the 1115, which many people are familiar with, and most of Access is under an 1115 waiver, and then there's also state plan processing. These are all just different vehicles of how we pursue changes to our system. So when we submit those to CMS, CMS reviews each request. And at that same time, of course, we're doing preparedness to make sure that we could implement if approved and what circumstances we would want to do that. When we receive approvals, we post them. And then once we have approval, we work internally with the team to see what work needs to go into play to operationalize those changes and when and if that change is needed. And then we would communicate that any new operational changes, so again, once we receive approval and operationalize that, we will communicate those changes through those FAQs, so they're very important. And then obviously, when new changes are implemented, we work with our managed care organizations, providers, et cetera. And Access is also routinely meeting with the managed care organizations and the provider groups out there, as well as ADHS, to coordinate efforts. Next slide, please. And I believe that kicks it over to Mohammed.
Hi there, this is Mohammed. Can you guys hear me?
Very good. Just speak up a little bit louder, Mohammed.
Is this better?
I think so.
Okay, fantastic. Hi, everybody. I'm Mohammed Arif. I'm the Federal Relations Administrator at Access. As Dana had said earlier, we've been working very, very hard to ensure that we have all the flexibilities that we need to combat the COVID-19, the spread of COVID-19 here in Arizona. We've been working to ensure that we have some of the flexibilities we need to reduce cost sharing for our members, strengthen the provider network, to also remove any barriers to care that's necessary to ensure that members receive the care that they need throughout this emergency period. So one of the obviously, we've been using several vehicles, as Dana initially mentioned. So one is being the 1135 waiver, the 1115 waiver, the state plan, as all potential vehicles for us to implement changes and to move our system forward and to allow the services and flexibilities we need to address COVID-19. As part of our initial request, we were in fact one of the first states to submit a request to CMS asking for authorities for our states. And we were lucky enough to say that we were also among the first ones to receive an approval from CMS for our 1135 waiver, which allows us to essentially remove the barriers of care and to allow us to streamline some of the processes we need for our response to COVID, specifically for our providers, and ensuring that their network and their ability to respond is effective. So next slide. So amongst the things that CMS has approved under the 1135 waiver are things like allowing out-of-state providers to provide emergency and non-emergency care for our members, streamlining provider enrollment requirements, and then waiving provider enrollment fees for the period as well. We're also modifying existing prior authorization requirements during this process and allowing us to sort of change some of those things as a result of the COVID-19 situation. We're also suspending or having now the flexibility to suspend pre-admission screenings and annual residence reviews for individuals in nursing facilities as well. And there are a lot of other flexibilities that the state or the CMS has given our state under this 1135 waiver. And all these documents are posted under the FAQ section. And if you follow the slides earlier that Dana provided, you should be able to find this information on our website. So next slide. So amongst the other things that we've been also following are federal legislations. As you know, the Family First Coronavirus Response Act has been signed into law, as well as the CARES Act, which was recently signed into law as well. Some of the provisions that are included in the law will have direct implications for access and for other state agencies across the country to address and to be able to respond to COVID. So some of the things that are required here are specifically under the Family First Coronavirus Response Act is to prohibit cost sharing on COVID-19 testing. States also have the option to expand coverage for uninsured individuals, and this is specifically to testing and testing related services for those individuals as well. And the state will also get a 6.2% bump as long as they maintain some maintenance of effort requirements, such as ensuring that the members are on access or are on the program for the duration of the emergency period. So very important provisions that ensure that members will have coverage throughout this time, and the states have the necessary resources financially and also operationally to move forward with addressing this crisis. Right. So among some of the 11-15 waiver authorities, this is not an inclusive list, and so we just wanted to highlight a couple of things that we're seeking. So one is being retention payments providers, including HCBS providers, and we think this is very important that our provider network is sufficiently available, and then we're addressing any necessary any problems in relation to provider and utilization in this difficult period of time. We're also seeking continuous coverage for our kids care to ensure that individuals, for example, that are above are reaching the age of 18 and moving on to the 19 could be on this program if necessary for the duration of the emergency period. So all things that we're CMS on, and to ensure that we have the flexibilities necessary to cover all of our members during this process. Next slide. So state plan authorities, we were in fact actually the first state in the country to submit a SPA that's specific to COVID-19. So some of the things that we've sought under this SPA authority are suspension of co-payments and premiums for our members. This is specifically for our Title 19 program members. We're also seeking the authority to cover the 100% FMAP population, and this is one of the things that is included in our state plan amendment submission. Next slide. So similarly, on the CHIP side, we also have to submit a state plan as well, and we're requiring essentially the same kind of authorities to ensure that we can suspend premiums for this population as well, and ensure that we can delay timely processing of applications and some of the other requirements during this period, such as delaying renewals and other flexibilities to allow our state to keep members on the program for the duration of the emergency period. Next slide. So amongst the next steps, and Dana, maybe you want to jump in here, and others. Essentially, we're really looking now to get as many flexibilities as possible to move our system forward. And as Dana said a little earlier, we're really working hard as well internally to figure out what changes we can implement and when we can implement those changes. And also, as you can imagine, we're working every day with CMS and communicating with CMS to see how we can move our system forward and to ensure that we have all the flexibilities needed to address the situation during this time. I think that should be all. Not sure if there's a next slide after this one.
Yes, we've got questions, and I'm going to ask a few that came up while you were speaking, and any one of you, the three of you can answer, but I'm also going to ask any of you that have a question, please type it into chat, because if we try to open up the lines, it basically we can't hear with this many people. So one of the questions that came to mind is, maybe I read it somewhere, or maybe I did not read your slide correctly. Is it true that undocumented people will be able to get some medical benefits other than federal emergency services, or is that a mistaken belief?
So, Joni, do you want to take this one? Maybe Joni's on mute. So I can take a first stab at it and okay. See you're working on getting Joni's on the line. So in terms of what's currently allowed for under the bill that was signed by the president recently, they're only allowing at the moment, and this is how CMS is interpreting this, is that they're allowing 100% FMAP for uninsured individuals, specifically for testing and testing related services, meaning that they're going to cover the office visits for the testing. But CMS has refused to give us additional flexibilities at the moment, or give states additional flexibilities to cover inpatient related services or other treatment related services after the person gets diagnosed with COVID-19, who's also uninsured at the moment.
And when you say uninsured, does that in fact mean, and I'm just trying to make sure that this is clear for all the assisters on the line, does uninsured in this case include people that lack permanent legal resident status or citizenship?
So currently we have the FES program, which is a program that allows some individuals who do not qualify for the full access program to enroll. And that would be a program that's still available for members. And in terms of the COVID-19 specific element that's talked about here in the HR bill, those are specifically for uninsured individuals who do not qualify under Medicaid, Medicare, or any other programs, or that do not have any commercial coverage. So those are some of the things that are specifically to that.
Very good. Thank you.
Alan, yeah, Alan, can you hear me now?
Yes, perfectly.
Okay. So I just want to circle back to your original question, and that was for those undocumented individuals, does their service level change? And the answer to that is no. They would not be given additional coverage in light of the pandemic emergency. So if they're FES, they would remain FES and get the services that they would normally be eligible for.
Let me just ask a question that relates to it, and it's to clarify. If an individual is FES eligible, is test or treatment for COVID-19 fall within the parameters of FES benefits?
I want to say yes, but I don't. I would imagine it is, because we're offering the COVID-19 testing to uninsured also. Can I just get back to you with an answer to that?
Yeah.
Okay.
Yeah, because even if it hasn't appeared in the chat, somebody's going to ask that
Yeah.
because one of the questions is, how does this relate to people that have been excluded other than FES? So, okay. Here is a question. Did I understand that uninsured can receive testing for COVID-19 currently, and that going through the request process with CMS, does that include uninsured people at or below 100% FPL?
So the provision related to the bill is specifically for folks that are uninsured and would not qualify for Medicaid. So if you're currently uninsured and your income is below the 100% FPL, that would qualify you, likely qualify for Medicaid. And you should seek to be on the program if you need insurance coverage.
Okay. I'm going to keep looking here for other questions. How do the uninsured access the free COVID-19 testing? Is it an application after the test, or is it being handled by the provider? And essentially, you can't get tested without a prescription currently. I think I'm correct on that. Please correct me if I'm wrong. Anybody have an answer for that one?
So I'm jumping in, and Joni, please jump in as well. Since the act was recently passed, and we're still in the process of receiving some guidance from CMS specifically on how states should operationalize this, we can't give enough information at the moment specifically to this. But stay tuned. This item will be on the FAQ soon, and we're really hoping that CMS will give states some guidance in terms of how they can implement this moving forward.
Excellent. And I want to say we do understand that what was true yesterday isn't true today, and what's going to be true tomorrow, we don't know. So we understand that this is a moving target, and we can't know everything today.
Alan?
Yes.
This is Dana.
Please.
I just wanted to let everyone know, I know Mohammed and Joni gave some answers, but there is a great deal of question, Q&A on the FAQ about testing, how people go about it, what codes we've already done in the system. And so while we're still awaiting more information and we still have some operationalizing to do, there is some information already up there.
I'm going to read one more question, and I understand if you do not have the answer because it is not exactly an access question, but it's related. And if you can't answer it, we will seek another answer. The question is, if somebody is approved for FES, is it going to impact public charge if they fall in that category of the people that are impacted by public charge? And if you want to defer that, we can go elsewhere to try to get the answer.
The public charge rule would not impact the Medicaid services provided.
The FES services, right? Or
correct.
Or other Medicaid.
Correct.
Okay.
Correct.
Okay. Yeah, I just hadn't looked up those things for a while, Shirley. Joni, so I just wasn't quite sure. Let's see what else we have, if we have anything else, and then we'll move on to our next presenter. So one of the things that's clear just by looking at the questions is we need to clarify, Marcus and Claudia and others that are listening, when we meet, we need to clarify how these new requirements may or may not impact public charge, because I'm seeing a number of different questions related to that. And let me see, I have one more that I'm trying to make sure I understand it. Okay, there may be some questions, Joni, that I'll send to you after the fact that as we sort through all of these, and I want to say thank you again. I know everything is a moving target. I want to say thank you very much for taking the time and putting the team on the line. And the same question that I asked John will be the last question, and that is, if any of these changes impact how Healthy Arizona Plus currently thinks, will they be incorporated quickly, or how will you handle that?
Yes, we will incorporate changes into the eligibility system as quickly as we possibly can. We have already put several changes in place that's modifying language pertaining to kids' care and freedom to work premiums. It's also, we've sent some separate notices out to individuals who are covered through 6 or 12-month guarantee programs to make sure that they understand they're going to continue to be covered throughout the emergent period. So as we identify changes that need to be made, we're making them as quickly as possible. We've made changes in the system that will prevent discontinuances for reasons other than those that have been noted as exceptions, which are basically if a member passes away, if they're no longer a resident of Arizona, or if they voluntarily are asking to be discontinued, we'll allow those to process. But nothing else is able to be processed right now because we want those who are covered now to maintain coverage throughout the emergent period. So we've already put some process changes in place in terms of Healthy Arizona Plus, and as we identify them, we're putting them in as quickly as possible.
Thank you, and I misspoke because I had one very important question that came up, and you and I have been discussing it. Can you address the issue of Healthy Arizona informed consent if you're doing the application as an assister, helping someone over the phone? And I do respect that you may not have all the answers. I saw an email from you, but I could not read it before the conference started. So do you want to direct people anywhere or share any information about the whole issue of getting the informed consent attached to a HIA application?
Absolutely. I know this is a very, very hot topic, and I have a team here in Member and Provider Services that are working on alternate methods to obtain that consent. So let me back up just a minute. So we are also inquiring with CMS to find out what will they allow us to do. For example, we've been asked, can we just document that we received a verbal consent? And we are asking that question, but we don't have information back from CMS yet. My team did put together a couple of fillable PDF forms that have an e-signature option, and they also provided me with some step-by-step directions on a couple different ways that the assister and the customer might be able to accomplish getting these done so that we can still be in compliance with that. We're going to be sending out a broadcast message to all of the assister organizations explaining the new forms, the purpose of the forms, and possible ways that they may be able to get them uploaded and be made available so that we're still in compliance. We still will pursue with CMS other options, such as being able to take a verbal attestation that consent was received, but we don't have anything yet that tells us we can move forward. So I'm hoping that these fillable PDFs and e-signature options might be able to help. Another avenue that I'm pursuing is with our Healthy Arizona Plus call center, dedicating a special line where the assister may be able to have the customer call that line so that they can help with getting a voice signature. So we're looking at different options because I know this is really critical. And as soon as we have any in place, we'll be posting them and sending out the community assister broadcasts. Does that
Joni, I
help?
want to yes, it does. And again, in this environment, we're trying to teach our children at home when we've never done that. We're trying to get all of our doctor's appointments done through telehealth when we've not done that. And now we're trying to enroll people in benefits over the phone. So we recognize nobody can have all the answers immediately. So I want to thank you for working. Excellent partner, and we will continue to help you push that message out. So again, thank you to your team. And are you getting any sleep? Same question as I asked John.
Enough.
Enough. Okay. That sounds like barely enough, but some. So we're going to move on now. Thank you again, Joni. We're going to move on to Skylar Hall from San Francisco area. Skylar is with Health and Human Services Department, and we've got a slide with his title on at the end, but he's going to be talking about special enrollment periods and some other things with the health insurance marketplace. And Skylar used to live in Arizona, so some of you may know him. So Skylar, you're on, and I'll flip your slides when you give me, I can see you, so you just give me the thumbs up.
Cool. Can you hear me now?
Yes, you're a little echoey, but go ahead.
All right, I will, hopefully the headset works. I'm in a conference room in the corner of FEMA Region 9 because in addition to just knowing all the things about the marketplace, I'm also actively working our response mission here. So very happy to take a little time away from all of those conference calls to assist you all in making sure that Arizonans continue to access all of the health insurance that they are entitled to. So this is going to be a very quick and dirty run through of special enrollment periods and how they are interacting with these very new and uncertain times that we're currently going through. So if you want to hit the next slide, we don't know what's happened. That's kind of where we're at right now. A lot of confusion running around. It's a lot of me searching through things. So let's just start at the very beginning and just run through where we need to get to. So let me start with a large caveat on this next slide, which is that there are three things that are certain in life: death, taxes, and there will come a time when this presentation is completely obsolete. I wholeheartedly expect that, knowing my luck, in like 3 days, this whole thing will change. So as they currently stand, these are the facts of the matter. And for special enrollment periods as a whole, these pretty much universally hold true. So let's talk about minimum essential coverage and how it's starting to impact during the COVID-19 mission. So first and foremost, qualified health plans. Let's just level set, just like we did back in October before open enrollment. All citizens and legal residents can obtain a qualified health plan with the 10 minimum essential benefits that we're all familiar with at this point. In the state of Arizona, that means going through healthcare.gov and enrolling in a plan there. So everything I'm about to say applies to qualified health plans either purchased through healthcare.gov or through Access, Kids Care, or directly through one's employer. So on the next slide, again, large caveats. Currently, the rules of the marketplace health plans for treatment for COVID-19 remain the same as if a consumer was going to get treated for literally any other viral infection. So it's important to, when it comes to treatments, check with your insurance company to see exactly what their specific benefits allow under the coverage that you have. On the next slide, there are some new things that have come down the pipeline that I want to highlight. As we've already sort of been talking about when Access was giving their presentation, lab services, as a result of recent legislation for COVID-19, are covered without copay or deductible. Again, that is just the diagnostic, so long as the diagnostic is approved by the FDA. So if you need to go get tested to see if you have COVID-19, if you are a symptomatic individual, especially if you have pre-existing underlying conditions, you can do that without fear of having to pay out of pocket for that. We also have greatly expanded telehealth opportunities and relaxed HIPAA to allow for new technologies such as Zoom to be utilized in telehealth provision. And lastly, as it pertains to enrolling in coverage, we are still operating under normal special enrollment periods. So if somebody qualifies for an SEP, by all means, they can go for it. But again, the same sort of 60-day windows apply. They still have to be eligible to enroll in a qualified health plan, so on and so forth. All right, so that's just lay of the land. Very basic, 201 level. This is minimum essential coverage in COVID-19. So we don't talk a lot about special enrollment periods when we do our sister training in October, because during open enrollment, that's what you're focused on. Everybody is fair game. So let's refresh on special enrollment periods real quick. Special enrollment period is a 60-day window outside of the November 1st to December 15th open enrollment period, where someone, if they have a qualifying life event, can go back through healthcare.gov and enroll or choose a different health insurance plan. So some opportunities for that to occur. Usually there's one of 6 qualifying life events that will trigger a special enrollment period. And on the next slide, I outline those. So that could be anything from a loss of qualifying health coverage, a change in household size, so birth, death, adoption, change in primary residence. So if you move from one county to another, for instance, a different service area, change in eligibility for marketplace coverage or financial assistance. So that could be because your income is significantly changed and all of a sudden you now get that financial assistance, or you fall out of or into the marketplace universe. The plan messed up, or healthcare.gov somewhere on the back end got buggy. And then lastly, other situations in quotes. So usually that's you became a citizen, you became a member of a federally recognized tribe, or you left incarceration, started or ended AmeriCorps, or another American service industry. So those are the ways to qualify for an SEP. Those have always been true. And obviously, loss of qualifying health coverage is probably going to be the one that we're going to run into most often during this COVID-19 operation. So let's dive a little bit deeper into that. So let's go specifically on that loss of minimum essential coverage SEP. First and foremost, if you're talking to a consumer, the question is, do they qualify? Do they clear the bar to even trigger this special enrollment period? So consumers may qualify for this particular special enrollment period if they or anyone in their household who is seeking coverage loses their qualifying health care. Okay? I can't have a Chiefs fan walking around in the background as a Bay Area resident. Still hurts. Okay, so if you can't see the webcam, that made no sense, but we're rolling through it. So again, if anybody on the application lost their health insurance or lost minimum essential coverage, then anybody who was on that application is going to be eligible. So just take, for instance, you have a family of 3, mother, father, kid. If the father lost his job and that's where the health insurance was from, everybody can go in and trigger this special enrollment period. Okay, so basically, when it comes to did you lose a qualifying health insurance plan, that's either through your job, through you lost access for kids care because you started making too much money to qualify, for instance. Some student health plans, so if somebody just graduated or they left school for some reason, if they had a group health plan that ended mid-year for some odd reason, if they basically turned 26 and aged off their parents' plan, or if they went off of COBRA, which I'll talk about later because COBRA is a whole special unique beast that most of the time you guys don't have to deal with. But getting back to minimum essential coverage, SEP, when do consumers not qualify? Because sometimes you can just ask, like, why don't you have coverage anymore? And that gets you to the solution you're trying to find. So the 2 ways that consumers don't qualify for an SEP under this circumstance that aren't particularly relevant for COVID are if they voluntarily ended their coverage, or if their coverage ended because of non-payment. So the exceptions to the first rule, if they voluntarily ended their coverage, if they left their job, if they quit and then they lost their coverage, they still qualify for an SEP. But if somebody, for instance, chose a plan during open enrollment, they called their health insurance provider and said, I no longer want this at the beginning of March. Now all of a sudden they're like, oh no, COVID is real. I kind of want my health insurance back. They're not going to qualify for an SEP. Same thing if folks didn't pay their binder payment, or if they haven't been paying their bill, all of a sudden they're not going to qualify for this SEP either. So basically, if folks were in good standing with their health insurance provider, then they're fine. On the next slide, the two questions you need to ask your consumers during COVID that are very relevant is, did the coverage that they lost qualify as minimum essential coverage? And has it been within the last 60 days? So if you remember back, short-term, limited duration health insurance plans are sort of the wild west of health insurance, right? They're that gap insurance. They're never really, in their original writing of the laws, they were never intended to be what people held for long periods of time. It was just to get between one health insurance to the other. Short-term plans do not qualify as minimum essential coverage. So if you have a consumer who has a short-term plan and all of a sudden wants to go through healthcare.gov and get a qualifying health plan, they can't. They do not qualify for a special enrollment period. Same thing is true for anybody who's on a health sharing ministry. The other question is, do they lose their coverage within the last 60 days? So obviously, this is incredibly relevant because most of the essential businesses in Arizona have closed within the last 2 weeks. So folks who want to qualify for the special enrollment period do need to take action relatively soon so that they can make sure that everything gets processed and ultimately they get the insurance that they need as quickly as possible. If somebody comes in July, they've been out of work for 3 months and then says all of a sudden, hey, I want health insurance, they're not going to qualify for this special enrollment period. So let's talk a little bit more about when this new coverage starts. Basically, if you qualify for this special enrollment period, you can trigger the SEP and choose your plan any day of the month, and it will start on the first day of the next month. So today is April 2nd. If somebody goes in tonight, they go through all the paperwork, they submit all the documents, they qualify for the SEP, their coverage is going to start May 1st. If somebody goes in on April 27th, their coverage will still start May 1st. That's the quick and dirty part of that, okay? If somebody knows that their health insurance is going to end, so for instance, they just got let go of their job in the past 2 days, but their employer is being nice and letting their health insurance cover them through the end of April, they can still go in and apply for an SEP that their healthcare.gov plan would start on May 1st. So they can get ahead of the game and make sure that they don't have a gap or a lapse in their coverage. All right, so what is verified and what do people need to actually submit when applying for the special enrollment period? So as I mentioned, consumers who qualify for a loss of coverage step have up to 60 days to apply, or they have to prove they're going to lose coverage in the next 60 days. Consumers have to upload or physically mail to Kentucky documents on official letterheads that clearly state who is losing or lost coverage, the date that coverage is ending or ended, and the type of coverage that they had, group health plan, something like that. So what does that actually mean? Because if you tell a consumer to do that, they have no idea what you're talking about. So we're looking for a letter or a bill from that insurance company that states the date that their health coverage ended. We're talking about a letter from their employer stating the date that the coverage ended. We're talking about a letter about COBRA coverage from their employer showing that the offer was extended, the cost. Basically, anybody who's been let go should have received a document that says, here's your opportunity for COBRA if you qualify. So what is this COBRA thing that we're talking about? All right, it's not something that as an assister you come across often. So if you want to hit that next slide for me, Alan. COBRA's a weird beast. It's very confusing. No, we're not talking about the Karate Kid. So next slide, we're talking about the Consolidated Omnibus Budget Reconciliation Act. Basically, this is the backstop to make sure that folks, when they lost their employer-based coverage, had some sort of opportunity to still access health coverage. It's different than short-term limited duration plans. COBRA can last, I believe, up to 18 months. It can be pretty extensive. The employer generally continues to contribute some percentage, and that can vary pretty wildly and widely. And so for many people, they find that COBRA coverage is actually more expensive than what they might find on the private market or by going through healthcare.gov. Okay, so these are the options that folks have been laid out thus far. Here are all the possible questions you have to have asked. Now let's think about exactly what this means for you and your consumers in the coming months. So let's talk about testing again. Oh, no, go back one. Go back. There you go. One, forward one. There it is. Cool. So let's talk about testing. So because of the Families First Coronavirus Response Act and a few elements of the CARES Act that both went into play in the last couple of weeks, any diagnostic testing is covered without copay or co-insurance. So again, as long as it's FDA approved, anyone, whether they're covered or not, should be able to walk into an office and say, I have symptoms, please help, and they can get that test for free. Again, these only apply to testing. Treatment, different ballgame. That is completely going to be based on whatever coverage you have with your health insurance. But in terms of testing, testing is the part that's free for anyone who is seeking it. All right. So next page or next slide. As it currently stands, CMS is not offering a special enrollment period specifically designated for COVID-19. So healthcare.gov as a whole is not just reopened for all, not open enrollment junior. Folks do still need to have a way to qualify for a special enrollment period. Hence why I gave you all of that preamble about the loss of minimum essential coverage steps. Most everyone you're going to interact with who's been negatively impacted by the COVID-19 mission, you're going to be screening to see if they qualify for this loss of qualifying health coverage step. All right. So all that being said, if you're actually having a conversation with somebody, they're going to look at you and say, did I have employer coverage? Is COBRA the right option for me? What are my suite of options? So on the next slide, let's talk about fundamentally COBRA versus healthcare.gov qualifying health plan. So if this is during open enrollment and somebody came to you and they're like, I'm trying to decide between COBRA and healthcare.gov, they can go on healthcare.gov and shop and things are perfectly fine. They can do as they normally would. Because we are outside of open enrollment, it's very important to know where the person is in deciding if they want COBRA or not. So basically, if somebody's on COBRA and it's running out, they qualify for a special enrollment period. As I mentioned before, that's going to be a loss of qualifying coverage because COBRA is qualifying coverage, and they'll be able to go in and shop on healthcare.gov. Similarly, if COBRA is too expensive or they have an offer of COBRA and they want to compare between healthcare.gov and COBRA, folks still qualify for a special enrollment period, can go in and decide to choose healthcare.gov plan during that SEP if they qualify. However, if someone accepts the offer of COBRA and then comes to you and says, actually, can I shop around now? They cannot. So again, let me be very clear. If someone is on COBRA or they've opted into COBRA and that COBRA coverage is not lapsing on its own volition, they do not qualify for a special enrollment period. So it's important to have these conversations with your consumers now before they decide if they're going to accept their COBRA or go through healthcare.gov. Because if they accept that COBRA, they're stuck until open enrollment 2020. It opens on November 1st. Okay. So that all said, you are now all hyper qualified to go have these conversations with your consumers. So let me just give you the high point takeaway, sort of the flow chart of how you should think about these, and then we'll field some questions. So does the person currently have a plan? They're on Access, they're on healthcare.gov, and they like it? Cool, you're good to go. If they lost their coverage and they want to shop around, you have to screen if they qualify for that minimum essential coverage step or any other special enrollment period. If they recently moved, that also works, to make sure that they qualify for a special enrollment period and go in. Make sure you're counseling that consumer. If they pay COBRA, then they're stuck until open enrollment period opens on November 1st. And no matter what, even if somebody's young invincible or however you want to qualify, and they're gung-ho about not having health insurance, make sure that they still know that they can get tested and screened for COVID through an official diagnostic and should not have to pay out of pocket for that. Because above all, we still want people to exercise good due diligence and make sure that they're keeping themselves and their community healthy, even if that means going without health insurance. And obviously, as to say, short-term limited duration insurance is still available. So if folks want to go that route, that's up to them. But again, it's not going to have those 10 essential benefits that we've all known and loved from qualifying health plans. And if somebody has a significant drop in income and qualifies for access or kids care, then route them that way. And that should take care of a lot of their issues. And that's going to have all those 10 essential health benefits that we know and love from qualifying health plans. So I gave you a lot of information in a very short period of time. So I'll take some questions now, but on this last slide is how you can reach me. That's me. And yeah, that's what we're here for. So what questions do you have? And if that was a lot of information, you need time to process them, just feel free to drop me an email when I can. But Alan, kick it back to you.
Well, thank you, Skylar. I'm not seeing any questions at this time. However, I want to say thank you. We miss you, and we're glad that you're able to help. And so are you going to send me some masks if you're working with FEMA?
Man, okay. I'm actually making a call right now around alternate care site. So I'm doing everything I can to make sure all Arizonans are taken care of. If you have an issue with your provider, or your provider has an issue, make sure they route it to the state or the county public health department, and we'll do our due diligence to make sure that all providers are taken care of as well.
Okay. Hey, boy, you've learned it well. The same question I asked the other people. Are you getting any sleep?
Sleep is overrated. I didn't sleep before this. Why would I sleep now?
Okay. Skylar, thank you so much. We're going to move on to Claudia Maldonado, and she's going to share some information with us about a few other additional resources. Again, Skylar, say hello to all the guys. Thank you.
Alan, can you hear me?
Perfectly.
Awesome. Okay, so just very quickly, we wanted to share with you some resources. You know, I'm not the expert in these resources, but we definitely want to make sure that you are all well aware that if you need to get in touch with Social Security, there's quite a bit that you can do online, and there's also a 1-800 number. So as you're working with the community, don't forget to route them to these resources, and a lot of the times they can help field some of these questions. The other thing is, if you don't know Jack Burns, he is the Public Affairs Specialist of Arizona for SSA. So definitely get in touch with him. He does a really good job of getting information out into the community about what SSA is doing here in the state. Next slide. So food resources, here are some links and some contact numbers that you can reach out to. So just know that you can, again, online, you can find resources in your area. Area Agency on Aging also provides meals to seniors. And also don't forget that St. Vincent de Paul has food available. As well as a lot of the local school districts in your area are offering free breakfast and lunch for children. So make sure that you are checking in with your school districts to see what they are providing in your area. Next slide. So Medicare, we have the Area Agency on Aging. They have the SHIP program, and their services are now being provided over the phone. So make sure you call the number. They are there to help you understand Medicare plan selection. They also help with the Medicare Savings Program, as well as the List Extra Help application. Again, if you don't know Marco Mendoza, he does a phenomenal job over there. He is the Benefits Assistance Program Director. They are busy providing services to the community. And
Marco, I see that you're on the webinar. Can you hear me, Marco? If you are, why don't you say hello, and do you have anything else to add to what Claudia said?
Hi, Alan. Good afternoon. Yes, I can hear you. Can you hear me okay?
Yep. Perfect.
Excellent. So thank you, Claudia. I really appreciate the comments, and I know everyone else is doing a fantastic job trying to get information to the community. I want to have a point of clarification for folks who need to call my program. Here in Maricopa County, my phone number is 602-280-1059. And then for the state, if they want to call the SHIP program, it's 1-800-432-4040.
Marco, would you just repeat both of those again in case somebody was trying to write them down? And
Sure.
or just put them in the chat. You could do that, Marco.
I can do that as well. And but I'll just say it once again. For the SHIP program in the state, it's 1-800-432-4040. And then in Maricopa County, for my program here locally, excuse me, it's 602-280-1059. And one thing that I'll just mention is that we've been able to allow all of my staff to work from home. They can do everything as if they were in the office. When they call clients, the caller ID comes up as if they're calling calling from the office. So there's not a strange number coming up on the calls. So even if they're calling to us, we're responding to our clients actually very fast with the support that we're getting from our volunteers, also working from home. But thanks for having me on, Ellen.
Hey, thank you very much. We appreciate that. And I'm going to type in those numbers in the chat in a moment. But now we're going to go to Marcus Johnson. And Marcus from Vitalist Health Foundation is going to talk a little bit about how do we explain things to consumers. And this, what he will present, is our beginning point. So Marcus, it's all yours.
Hey, Dan, hope you can hear and see me potentially.
I can hear.
You also hear background noise. Alan, I might need you to mute the 9-month-old that I'm trying to watch over also right now. So, Alan, if you want to go to the next slide. We want to provide just a couple of talking points and resources that everybody can really be focused on during this time of great need. So we tried to put 3 simple resources that people can be reaching out to. If someone needs health insurance, quick and easy place for them to go to, healthyarizonaplus.gov. Based on some of the numbers that we had earlier today about unemployment, based on some assumptions about where that income eligibility will be, they're likely going to be eligible for marketplace and or access coverage. And so the best place, if they know that they need to directly enroll in health insurance coverage, is for them to healthyarizonaplus.gov. That can also obviously link them to other public benefit programs. If someone wants to talk to a professional about the coverage options that might be available to them and their families, they want to go to coveraz.org/connector. That's where there's a statewide network of assisters and navigators who are available to provide, or it used to be in-person assistance, telephonic assistance now, in order to walk individuals and families through their various coverage options. So again, the difference there is, one, if they know they need health insurance coverage and they want to get enrolled right away, just have them go to healthyarizonaplus.gov. They want to talk to somebody and schedule an appointment with a navigator or a sister, coveraz.org/connector is the place to go to schedule an appointment with, it's a free appointment for people to talk to an assister. And I know there's a number of other resources that are out there. I think we all are receiving a ton of email from some of the closest organizations and partners trying to invest about a variety of resources that are local. Really, the best one-stop shop for social service type resources across the entire state right now is 211arizona.org, or by calling 211 on an individual's phone line. Consumers can use this, assisters can use this, professionals, case managers, anybody can use this website or this phone number to try to locate whether it's employment services or utility assistance, food assistance, housing assistance. This is really probably the single best one-stop shop that we have in Arizona. So we'd highly advise utilizing that as a resource. And the governor's office was also able to procure funding to make sure that they have enough staff to be able to answer the phones, as well as to have as much personnel as possible who are manning the online portion of 211 resources as well. So, excuse me. So it's a great resource for folks to go to. Alan, if you want to go to the next slide. We also have here just a couple of quick, easy to share items for social media or for any other marketing materials. If you go to coveraz.org/outreach, there's a section at the top, which is the COVID-19 enrollment response section. It has these two resources. You can click on the PNG images, share them as widely as you'd like. It basically goes over the 3 talking points that I just went over. We have it in English and in Spanish. And on that website, you're also going to find a PDF that has a number of other points and language for Twitter and or Facebook if you want to find something to be able to repost to your followers on social media. So again, just as simple as possible, 3 things. If you need health insurance right now because you've lost your health insurance coverage through your employment, go to healthyarizonaplus.gov, see if you qualify for Medicaid. If you don't qualify for Medicaid, it'll link you to the marketplace. If you want to talk to somebody, go to coveraz.org/connector, schedule an appointment with an assister. And if you have other social needs that haven't had met, go to 211arizona.org or dial 211 and talk to somebody about the services that might be available to you and your family.
Is that it, Marcus?
That's it.
Okay. Ladies and gentlemen, I want to say, first of all, we have so many people to carry on a real discussion would be nearly impossible. But our goal was to first get information to you, but we need to find out what else do you need. If you're an assister or involved in helping people navigate their way through systems, what information do you need? I've purposely put my email address up. Feel free to send me email questions. I will get them to our experts. We will get answers. This session has been recorded. As soon as we can get it edited and put together, we will post it on a website. And since you had to register to get the URL for this webinar, we will send follow-up information to all of the email addresses of people that registered. I want to make one clarification before we sign off, though. It's an interesting situation. If somebody has purchased a short-term limited benefit plan and if somebody has no insurance and they get sick and they get tested for COVID-19 and then say, hey, I need some insurance, you cannot get a short-term policy in that situation because your COVID diagnosis would be a pre-existing condition. So I say that just to remind people that the short-term plans exist in a different world than a solid employer plan or a healthcare.gov plan. Just one of those things that I thought I should point out. And again, Marcus is raising his hand. I will recognize you, Marcus. Go ahead, please.
I also wanted to just allow a minute or so for if Anna Rossetti from the Arizona Department of Health Services is on the line. Anna and her team are trying to compile as much information as possible for the state health department right now and trying to fill some gaps that are out there. And I know that she was really interested in hearing from the assister community, in part about how telehealth and telemedicine might be able to be expanded throughout the state, amongst a number of other things. So Alan, I don't know if you're able to unmute Anna's line. Anna Rossetti.
Anna Rocati?
Yes. Can you hear me?
Yeah, I've opened it. Yes.
Yes. Okay.
Yes, we can.
Yeah, thank you so much for the opportunity, Marcus and Alan, to speak, and thank you for hosting this webinar. This is very helpful. So many of you may have heard about the executive order, which expands telemedicine services statewide. This was mentioned by a number of our speakers today in terms of a lot of the noise around providing telemedicine or telephonic visits to our patients to be able to respond to the COVID-19 crisis. So as Marcus mentioned, I'm part of a telehealth workforce that's created by ADHS in response to the executive order. And what we're trying to do is to identify barriers from the community, either from the provider side as well as from the patient side, in terms of barriers to either adopting telemedicine services, or from the patient side, what barriers are they having in accessing care via telephonic or telemedicine. And so, for example, we have heard from our partners that there continues to be concerns from the provider network around billing issues or coding or liability issues. So we're basically gathering all of the information that we hear from our stakeholders and from our partners. And then also from the patient side, we heard that specifically for low-income patients, there were issues with conducting telephonic visits because people are running out of data on their cell phones or minutes. And so those are the kind of things that we want to look into and see whether we could, as a state agency, come up with resolution to be able to address those issues so that we can help our state to be able to address the crisis collectively. So if you have any kind of feedback that you can provide to the department, to me, you can call me. I can leave my contact information in the chat box. If you wouldn't mind just giving me any information related to anything that you may have experienced or hearing from your patients in terms of accessing telephonic or telemedicine visits, that will be very, very helpful for us. Thank you.
Thank you, Anna. Thank you, Marcus, for making us aware. Anna, if you would please put your email in the chat. We'll also make sure that we include it in any follow-up. And personally, I should be able to send out a quick survey to the community health centers in the state and their sister community. While providers are already working on the telehealth side, this is kind of new for the assister community. So we'll try to get you some information. And again, we know that ADHS is swamped. We appreciate all of the state agencies and the federal agencies that are working as partners with us. We have been very, very fortunate to have good relationships. There are a number of questions that I've seen pop up that relate to specifically what insurance plans are doing. And what I'm going to do is defer those questions and try to answer them to some of the people that asked them as well as generally, because there's a lot of questions about if I have this kind of insurance or that kind of insurance. And even though the testing is covered, what's it going to cost me to walk into the ER? What's it going to cost me if I have to be hospitalized for 2 or 3 weeks on a ventilator and I have a high deductible? All these type of questions, if people are thinking about, gee, I might really get sick and I might really get hospitalized, but most people who buy insurance assume that they're never going to have to use it. So we'll capture those questions and do our best to get them answered. I'm looking at the chat and I don't see Anna's email yet. If it doesn't pop up right now, we will get it included in our follow-up information. So
I answered it, Alan, so you should.
Okay. Did you send it to everybody?
Yes.
Okay. There
Otherwise-
it is. There. Yeah. I was someplace else in the many texts, or I should say chat. So yeah, that Anna's number is 602-542-1066, and it's also posted there in the chat, and we'll put it in the follow-up information. And questions that we couldn't get to today, we will follow up with. Thank you for all of us for putting up with a 2-hour webinar. That's kind of gruesome, but this was a lot of information. Please, if you don't know who to contact, get a hold of Marcus or myself, and we will get you redirected. With that, I'm going to open up the lines and hear the noise as you all click off. Thank you all very much for joining us. This ends our session.
Thanks, Danny. You bet.